Good afternoon, everyone, and welcome to today's seminar on COVID-19, 5 critical takeaways for your shelter and clinics. I'm glad that everybody could be here on such short notice. Things are changing really on an hour-to-hour basis, especially here in Florida where there's so much COVID activity. I am going to be spending approximately a half hour talking about some recent updates to the management of shelters and clinics in the state of Florida, and then also bringing in my colleagues, Dr. Sarah Kirk and Dr. Sara Pizano, to answer your questions in a live Q&A about the urgent information that you need for operations. I start with this picture when I talk about the COVID-19 outbreak because it's really tells the whole story to me. This is a physician who has not seen his child for several weeks because he's been working in the hospital in the emergency department. And when he came home, the closest contact he could have was through the window here with his son because he was contaminated. And this Facebook post from his wife talks about the trauma to the family and encourages everybody to stay at home, and that's why she posted it. And so you will be hearing a theme today about our responsibility for social distancing and stay-at-home orders everywhere we can so that we can protect our staff and our communities from the spread of this virus. It's the single most important thing we can do is to not be out in our community. And in fact, we'll talk about it in a little bit, but in just the past hour or so, Governor DeSantis released a stay-at-home order from the state. So we'll be hearing more from Dr. Kirk about what we know about that order so far. So I took this map from today's reports, and so it's very, very current. You see that nationally there's almost 200,000 infections and almost 44,000 deaths. This is rapidly spreading, and we are not the epicenter of this outbreak, but we do feel like we're only a week or two behind what's happening in New York City. So we can look to them to see how we are going to need to cope. Some of the new information that's especially chilling is that people without symptoms have been shedding the virus for days before they get sick. And this means that our initial approach to controlling spread of this virus based on segregating people who have clinical signs has not been working. And it's now believed that a quarter to half of virus carriers are shedding people and they don't even know they're infected yet. This is really important information that should inform our decisions about being out in contact with other people, even if we're trying to follow social distancing instructions. And this is today's status in Florida from the Florida Department of Health. This is an online website that you can look at for real-time reports on the number of infections and deaths. You can click on your county to see what the current status is locally. So 7,000 cases so far, but keep in mind that we still do not have rapid access to testing. Most of the testing is being done on people who are symptomatic, and we're still hearing that people are asymptomatic but exposed or not able to get their testing done. So this definitely underestimates the number of cases. And in counties that have not yet reported any cases, those counties also have very little access to testing. So we shouldn't consider any area of the state to be free from infection. This is a fairly sobering model that you can look at on the internet. It's called COVID Act Now. You go in there and you can click on your state, and it predicts based on epidemiology at what point your state's hospital systems will be overwhelmed. And so this is today's data from Florida. The dashed line on this map shows hospital bed capacity in ICU. And the red line shows the expected number of hospitalizations that will occur if there's limited access or limited action for reducing infection. And in that case, we see that we are already would be approaching hospital overload. But fortunately, we have been doing social distancing to some degree in Florida. I know we've all been disturbed by the pictures of people partying on the beach. in high numbers or people that are still going out in group gatherings and instead of staying home and socially distance. But if we have commit to 3 months of rigorous social distancing, we will not exceed hospital capacity until towards the end of this month. But it will come, and you see that peak above the dotted line is the overload that the hospitals will be facing. However, if we do 3 months of shelter in place, then we will not exceed, we're not projected to exceed hospital overload. And that is the green line, which barely comes across the bottom of the line. And that is something we can do. The governor's calling for us to do that now. There aren't yet really strict guidelines for us to follow, so we need to use the judgment about what shelter in place means. That means you only go out for essential tasks. So if you need to buy food or get medicine, and if your job is life-saving and essential, but all routine activities are supposed to halt. The most effective way to stop the spread of this virus and prevent hospital overload is 3 months of lockdown. This is the tactics that they used in Wuhan, China, and it was very rigorous. They had police in the streets sending people home and even threatened the death penalty for people who didn't follow it. So I think it's safe to say that we won't get to exercise the option in the purple line, which is the most effective, but we can move to being very compliant, good citizens with shelter in place. I have this cut from a news article already in Miami, which is feeling this crisis very intensely with a lot of cases and a lot of rapid spread, and that the doctors that are working in these emergency clinics are already feeling the overwhelm. They're not adequately supplied or staffed or have enough beds for the patients that are flooding in, and it will only get worse over the next few weeks. The FVMA has stood up this excellent interactive website where you can look at the shelter-in-place information for your county. Now, I'll say I did this screen capture this morning, and these were the counties that already have some business restrictions. And if you click on your county, you can actually read what those business restrictions are. I imagine our friends at the FBMA are working very hard right now updating this because of the new statewide shelter-in-place order. But we're going to be talking mostly about shelters and, by extension, clinics that are doing spay, neuter, and other services. And we can't talk about all of the activities for that apply to shelters, but I felt like these were the 5 key takeaways that developed as we started planning for emergency response to the COVID pandemic. One is to preserve critical functions. When we talk about animal control and shelters, there are some public safety needs and animal welfare needs that cannot be stopped. We'll talk about what those are. And by extension, then we need to suspend all non-emergency functions. And a lot of these are important functions. They're essential functions, but they're not emergency functions. We can pause those. There was a call to rapidly reduce shelter populations through fostering and adoption and calling the community forth to stand with us and help empty these shelters as quickly as possible. And across the nation, there has been a huge spike in adoptions and fostering. It's been very rewarding to see people come by shelters to help them cope with this. At the same time, we've looked at reducing intake to shelters for all but emergencies. And what this has done is allowed shelters to prepare for massive workforce reductions as people get quarantined and get sick, and we know that's coming, and also to let people shelter in place so not as many people need to come to work to take care of animals. But at the same time, we don't want to risk losing any of the ground that we've had in our life-saving progress. So we didn't want to have euthanasia being a tool used to reduce those shelter populations. And we've seen a remarkable amount of new innovations that are being used in shelters. And a lot of what we're learning now will be carried over into the post-COVID era. And then finally, I know everybody wants to know how they should handle animals that are coming from homes where there have been COVID exposed people. So this will happen when, say, the patient has to be hospitalized and there's no one else in the household to take care of their pets, if there isn't someone, a friend or family who can come get their pets, animal control will have to go with the police to get in and take those animals and then house them safely in the shelter. So this is what I'm going to spend the rest of this session talking about today. So just a refresher on the landscape of animal sheltering. There's about 5,000 animal shelters. They are not networked in any way, so getting concise, consistent information to all of the shelters across the country is very, very difficult. Even in Florida, there's not a registration system for shelters. The state can't send out an alert to all shelters because that directory doesn't exist. We've been working at the University of Florida to develop that communication network, so please do keep your contact information with us up to date, because this is how we push out information during a crisis. There's also an unknown number of rescue groups and foster groups and sanctuaries that really aren't on the radar at all, and yet they're caring for animals. Brick and mortar animal shelters take in over 3 million dogs and 3 million cats a year, so this is a very large population that we're talking about. And of course, this couldn't come at a worse time. March through August is kitten season. Right now, all of the cats are pregnant, and so we have a huge amount of anxiety about shutting down our spay-neuter programs, because we know that is going to increase the stress on our system, and we're going to have catch-up that we have to do when we return. Shelters had been told to prepare for a 50% or more reduction in their workforce due to home quarantines and shelter-in-place orders, and we're seeing that happen right now. But know also that there is, at this time, no evidence that pets can transmit COVID-19 to people. However, there have been 2 dogs and 1 or 2 cats, I can't quite tell, that have been shown to acquire COVID-19 infection from their owners. 1 cat was sick. It's not clear if it was sick from the virus or for another reason. And then just today, there was a paper that experimentally infected ferrets and cats. And they housed, the ferrets had more upper respiratory disease, but they did get sick. The cats had both upper respiratory disease and pneumonia. And when they housed those experimentally infected cats with an uninfected cat, so that there could be aerosol connection between the animals, the exposed cats did get infected and did have at least had histological evidence of disease. So this is new information. I think it's going to trigger some new guidance and new concern. I wouldn't say we need to panic about it, that cats can be infected and can transmit the virus to other cats. We don't know if this is meaningful outside of the lab, and it's not really a surprise that this would happen because it happened in the first SARS outbreak. But it is going to cause some pause and possibly new guidance. On the left-hand side of my slides, I do have some quotes that I've been hearing from our industry over time that have really been meaningful to me, so I'll read those out as they come up. And certainly there's nothing truer today than this quote: "There is so much we don't know, but that doesn't mean we can't act." We are learning from an hour-to-hour basis about this virus and what it means to people and to animals, and we have to be pivotable. We need to be able to switch our gears quickly, but we cannot be paralyzed by the lack of knowledge. So let's talk about these 5 critical functions. The first one is to preserve the critical functions. These really are our animal control officers. They are first responders on the front lines. We have to keep them healthy and on the job to protect people and animals in our communities. It's also very important that animal control, animal shelters, and veterinary clinics be designated as essential services so they can stay open to care for emergencies that need to be done. I would say that most of the states and local statements have included these agencies in their list of essential services, and if they have not originally, they've been very responsive to adding them. So if you are advising anyone on developing these emergency orders, make sure that these agencies are included in the list of essential services, but understand that doesn't mean we do everything that we normally do. Animal control be tasked with assisting law enforcement entering houses to retrieve animals, or cruelty responses or other high intensity situations. They will be asked to pick up and admit injured and sick strays, to respond to cruelty and neglect complaints, dangerous dog complaints, and shelters will have to take in animals that really do need protective custody. And this should be a pretty small list, but we need to be there for domestic violence situations, abandonment situations, and other cases where animals just have to come in because they're not safe where they are, but not routine intakes. That flip side of that is we need to suspend all non-emergency activities. And this is where it hurts me a lot. If you know what I've been working on for the past 3 decades, it's spay neuter, it's community cat management, and TNR. And we have a very active, big, large-scale TNR program that I founded 20 years ago in Gainesville called Operation Catnip. We perform 5,000 to 6,000 surgeries a year, and that's just about all we do. And we were one of the first to close our operations because we knew that we were not being responsible by keeping our staff on the job and bringing our people into contact with caregivers like this woman who's one of the people that we serve. This is her ear-tipped cat that she adores, and that we have served her in the past, but we could not be asking her to trap and coming to the clinic. Even if we're doing curbside drop-off and other distancing with our clients, there's no way we can run a clinic and not have our staff coming together. And we made a decision early on to take a financial hit and be criticized within our own animal welfare field for maybe not worrying as much as others did about kitten season, but we are assured that we made the right decision. Now, we have flipped some of our staff to doing deliveries of food of both groceries and cat food and pet food to people who need help, so they can stay home, and then we just drop it at the sidewalk so they can pick it up. So we do, and then we also have an emergency service for critically ill or injured cats. That has really scaled back our operation. So what are the non-emergency services? I would say in sheltering and rescue right now, this is the most controversial topic that we're dealing with, is where to draw the line. So our Animal Control Association has come up with a list. So non-aggressive stray pickup is no longer considered to be an emergency service at this time. So a dog running down the sidewalk that is not causing a problem or is not a threat, or cats that are free roaming, are to be left in place unless they are at immediate risk or they're causing immediate risk to someone else. Of course, all the nuisance leash law, licensing complaints, barking, arguing neighbors, that also is taking a back burner, trapping and transporting community cats. And then a bitter pill to swallow was shutting down the public spay, neuter, and wellness clinics. We are trying to replace those as much as possible with telemedicine options, and we are suddenly, quickly thrust into the world of telemedicine in a way that we never expected to be. We are seeing regulatory agencies address the need for this very quickly and loosening things up, and Dr. Kirk will be sharing what she knows about the telemedicine landscape. We're also trying to stand up some more services for shelters to help support the amazing number of foster homes that have taken in animals by the thousands that are going to need help. These animals were placed in foster without spaying and neutering first, so there are going to be some kittens born in foster home, and a lot of these folks are fostering for the first time and have little experience. So we're working on some support for this very rapidly. So what are the definitions of elective and non-elective procedures? Hopefully Florida will be sharing out a list and also getting input from all of us about what that list should contain, but I thought I would share a couple other examples. This is for the emergency order in Oregon. They said that they shut down all elective surgery and then said, keep in mind that a procedure or surgery is exempt if a 3-month delay in the procedure or surgery would put the patient at risk for irreversible harms. And this is a pretty strict list, I think. It's threat to the patient's life, irreversible harm, permanent dysfunction, metastasis, or rapidly worsening conditions. So they were not very broad in what they considered to be essential procedures. And you'll notice pregnancy doesn't make their list. This is the emergency order from North Carolina. They described what they defined as being allowable in shelter-in-place and stay-at-home, but they also call out specifically, don't forget that the services that you include as essential will potentially place the following people and their families at risk: the client, your employees, and yourself. And I love this from the New Jersey VMA. They asked us to interview on every single intake or procedure these questions so that we can answer for ourselves if it really was an emergency procedure. Is this procedure necessary to save an animal's life, to alleviate pain or suffering, to prevent zoonotic disease? Is there any way it could be managed in another way to mitigate COVID risk? Does it require the use of scarce resources that are needed for that should be human medical care? And can the patient safely wait until resources are less scarce and human health risks are lower? So it's a gut punch to say that routine spay neuter is not making the cut for non-emergency surgery. We need to pause what we have come to do as our key function for many of this, to protect personnel, preserve resources, and relieve the coming burden on the healthcare system. That means neuter before adoption, which is required by law in many states, including Florida, to adopt and foster with sterilization agreements that we can follow up on later. And I was talking to some shelter executives today. We also are going to be asking the state to allow us to place those animals without deposits. Right now, there are deposits that are required, and that is creating an administrative burden. It is keeping people who need to have their cash flow intact right now from adopting because they don't want to have their deposits tied up for a few months. And we also don't want to have a huge administrative burden on the other side of the pandemic when we open back up to process all those deposit refunds. So the best thing we can do right now is have good, strong agreements and not to have a fiscal deposit system in play. Also, all of the software companies for shelter software and spay neuter clinics are standing up modules that are going to help with mass communication and tracking and reminders for those animals that have been released and rescheduling them as our clinics start to open back up. Trap neuter return programs, we need to leave those cats in place for now. I will talk about an option for an oral contraceptive for female cats that may help, but we at the beginning of kitten season are taking a very painful stand that we need to leave the cats where they are so that we can keep people safe. However, we don't want to euthanize or hold animals in the shelter pending spay neuter. So very often, we have heard that some shelters have decided to euthanize their animals because they thought they could not release them intact. And that is not the case. We need to push those animals out into homes intact and follow up later. Similarly, if we have a slowdown in access to spay neuter, we don't want animals staying in the shelter longer, waiting for that spay neuter capacity to open up, because we need to limit the number of animals that are staying in the shelter. And so what we're seeing across the country is the rollback of neuter before adoption laws, or just pauses in enforcement so that we can make the best choices. And this is a quote from a large municipal shelter director in Florida when we were talking about this, and she was so proud of the scale up of her TNR program over time, and it was really starting to have a great impact on her shelter intake. And she said, we were all making fantastic strides, and this is a gut punch to me. So I did want to mention, this is brand new information, that there is an oral contraceptive for female cats. It's low-dose megestrol acetate. It is given once a week, and it is very effective for suppressing estrus. And so this can be used for all of those female cats that we put out in foster homes, especially if we put them out there in mixed litters of males and females. So there is guidance for this use on the ACC&D, that's the Alliance for Contraception in Cats and Dogs website, given you the web address here. We'll put it in the chat as well for you. And then you can see it's very cheap drug. It's pretty safe at this low dose. It's not as bad as we remember from the higher doses that used to be used, and it really is a stopgap for this important time in kitten season that we have. Some caregivers are also using it for managing their TNR colonies when they're waiting for surgery. We talked a bit about reducing shelter populations. This is the time to do things that you've never done before in your shelter in order to have the minimum number of animals in the shelter that need to be there. We are rolling out appeals to communities through social media and other means for emergency fostering and emergency adoption, and reducing any barriers to getting animals out to homes where they are safer and where our staff can be safer because they don't have as much work to do in the shelter. So there really is no reason to keep any animal in the shelter unless it's dangerous or needs some sort of medical care, or it's in like a legal case that can't be pushed out. All of the other animals should be in foster homes by now, and if they are not, the window is closing on pulling that off. And I think with our emergency order that goes into effect at midnight, maybe there's only a few hours left. So Dr. Pizano in the Q&A can provide more detail about these tactics for reducing intake and promoting releases from the shelter. But some of the ways that we do this is by returning pets in the field. So our officers can really make an effort if they have a loose dog to knock on doors and to ask neighbors and to scan in the field and do anything they can to figure out how to return that animal to its owner without coming into the shelter. We are suspending all non-emergency owner relinquishment, building up the safety net programs for vulnerable populations. So this might be like dropping off food for people who don't have enough pet food or food for their families. It can be providing pet-friendly sheltering with the people. We're seeing this with our homeless shelters where there is reduced capacity right now in homeless shelters, and that's going to become a bigger problem as more people lose their jobs. There's a lot of furloughs going on this week, including in animal shelters and spay-neuter clinics. And we would like to have housing where they can take their pets with them instead of giving up their pets. Sheltering in place for pets of COVID-19 infected pet owners. This is so important. Our officers are really afraid of going into homes of people with infection, and our shelter staff are very nervous about having these animals in the shelter. So we're doing everything we can to let people who have COVID-19 keep their pets in their home, and encouraging owners to have a plan A, B, and C. If they need to go to the hospital, who can take their pets for them? And what if those people need to go to the hospital? Who can be the next generation of helpers? We want to do everything possible to keep animals from coming into shelters. And then shelters and clinics really need to plan seriously for workforce reductions. There's a lot of people who are going to be out sick. It's estimated that eventually possibly half of the U.S. population is going to become infected. And a lot of those people, even if they're not sick, or if they just have kids at home that they need to take care of, they can't come into work. All right, I have a blank slide. And some of the unprecedented actions that shelters are taking to respond to this and empty their shelter have really been remarkable. And it is so rewarding to see how communities have been waiting to be asked to help their shelters. So these two snapshots from Facebook pages show what some shelters in Texas have done. These are from Dallas, I believe, and they put out a call for emergency adoptions and fosterings, and they removed all of the barriers to doing that. So there was no longer like certain dates that you had to come to orientations. They just trusted the community to come and get their pets, and then they're going to support them in the aftermath. So hundreds of animals went out in this week. more than had gone out in weeks before. And Dallas really did declare that this was a state of emergency they were asking for help with, and the communities stood up. We, of course, want to make this safe, so we still are saying that getting animals out of the shelter is an emergency procedure that it is okay to keep doing. But if we're going to do that, we need to be very good about distancing ourselves from the public. So curbside, appointment-based adoptions, and fostering tele-adoptions where there's no face-to-face contact at all are really working. And we're going to share some resource lists that will have SOPs and flyers and scripts for how to do this. This quote is from Kristin Auerbach, who is the director of Pima Animal Control, one of the biggest shelters in the country in Tucson. And she did a huge drive. They normally have 700 animals at a time in their shelter, and they're down to about 300 now through this activity, and they are maintaining their 90% live release rate. And her quote is so true. She says, "We must move faster and be braver than ever before. We have to act without always knowing if the choices we're making are the right ones or if they're going to be the same tomorrow." Another tool that we'll have to support these foster homes and new adopters is the Best Friends Vet Access app. This is from a company, Vets Plus More, which has been serving private practitioners with 24/7 access to a veterinarian to triage pet owners' concerns. And they cannot at this time diagnose and treat and dispense, but they can look at pictures and have a FaceTime chat with an owner and tell them whether they do in fact have an emergency, if they need to go to an emergency clinic, if there's some simple first aid for a minor condition that they can do, or can escalate that concern to the shelter or the private practitioner's own veterinarian. So it's a way to take some of the heat off the shelter staff in its diminished state so that all of the screening can be done, and only the vets will only have to deal with the truly urgent cases. You can get this access to this if you're a shelter for free if you join the Best Friends Network. So go to this link to see how that works. And then handling the COVID-19 exposed animals. We so far don't have reports of COVID-19 infected animals in the U.S., but we can assume that is coming. They really haven't been tested much from high-risk homes, and that's starting to happen with the public health officials. So we wouldn't be surprised, but we do expect there will be lots of animals coming out of the homes of infected patients when they can no longer take care of them. So this is what we want the shelter to look like when that starts to happen. We've done such a good job emptying the shelter that there are whole rooms empty that these animals that have to come into the shelter can go into. And officer and shelter staff safety is our #1 concern. So we will want to keep emphasizing doing whatever we can to keep exposed pets with their families, keeping shelter intake as a last resort. And if they cannot keep those pets, then to have friends or family that can take care of them for them. Our officers should avoid entering the homes of infected people if needed to retrieve pets. We're hearing very scared officers saying that they are being told by police that they have to go into homes without PPE to retrieve pets, and that is absolutely not true, and they need to refuse and call their supervisors. We need to make sure that our officers do have the PPE they need, and so that's one of the reasons we're preserving it instead of using it for spay neuter at this time. And the best thing is if someone who's already in the home, like a family member or a neighbor, can go in there, get the pet, and bring it out to the sidewalk so it can be loaded up without the officer entering that high-risk home themselves. There is new guidance that came out yesterday from AVMA and CDC that downplayed our recommendations for bathing. So they're no longer recommending bathing exposed animals at intake, nor is there a recommendation to dip or wipe the animal's fur in Excel. They are simply saying that you should house these animals in separate from the general population for 14 days. So this is good news and bad news. We did not get a dire requirement for how these animals are housed. They should be separate from the general population. If you only have one population, you can just rope off some of the area for your animals. Ideally, they would get the double-sided housing so that they can be cared for and cleaned without actually handling the animal. They can just be shooed to one side or the other. If you do need to handle the animal, you need to wear PPE. At this point, it's mostly contact with skin, although respiratory is still a concern. So we would say coverall. It's fine to use cloth PPE that's laundered. It's easily killed in the laundry. So we would want boots, coveralls or gowns, gloves, and mask or face protection would be the ideal PPE if you have to handle the animal, and hopefully that you don't. So we have, we'll give you a link to this new interim guideline. It's available on the AVMA website. You can find it at this link, and it has very detailed instructions about how to manage these animals. So this is all very discouraging and frightening for all of us. We do know that it's unbelievably sad that we are giving up so many of the gains that we've made in animal welfare, and it feels like an impossible setback. But we do know this is going to be a few months of this kind of lockdown, not a few weeks. That we have not hit the peak yet in this country, and especially in Florida. And we also know that we're already planning on how to come back bigger, to have bigger spay-neuter programs, better functioning shelters, stronger clinics. But we need our vets, staff, clients, and trappers to stay safe, stay strong, and to be ready to come back when we are ready to roll out operations again. If we've lost people to illness, that is going to be a much longer setback than what we have to do now. So a lot of us and our staffs are feeling very stressed at this time. We've lost all the control that we wanted to have in our lives. We're afraid. We don't know how this is going to go. A lot of people are losing their jobs. It's a really scary and hard time. So we have recorded a webinar from our compassion fatigue educator, Jessica Dolce, that is a really powerful self-help guide to get through this. And I was really just inspired by the advice that she gave and her compassion and understanding for what we're all going through. So that's available for free at this link, and you're all welcome to share it as widely as you like. And I hope that you make time for all of your staff and volunteers and caregivers to listen to it for their own strength. And then finally, this is my last slide. This is, I know that there are so many newsletters and websites and examples of work and new updates coming through that it's really, you could make a career of just reading your email, but that's not going to help us get the work done. And so a lot of national groups and the shelter medicine programs across the country have come together to filter this information on a daily basis, and we will send you a daily digest of what we think are really critical things for you to know. So you can sign up at this link here. We'll also put it in the chat, and you will get that once a day email that can be your top priority reading. So with that, it's the end of the slides, and we can open it up now for questions. We have Dr. Sarah Kirk, who's going to handle some of the regulatory issues that we're hearing about, Dr. Sara Pizano, who can answer questions about how to really make that intake diversion and increase positive outcomes really work in the real world. And I'd be happy to talk about any topics on shelter operations, how to handle animals that have been exposed, or other questions along that line. So Todd, I think, is going to, has been monitoring the chat and the questions, and he can tell us how to submit a question, and also will be reading them for us.
We can't hear you, Todd. Todd, can you hear us?
I can't hear you, Todd.
I can hear you. Okay, Julie, while Todd's figuring that out, I'll tell you there was a couple of questions. They were going quickly in the chat. about rabies clinics and rabies being essential, rabies vaccinations at the exact time that they're due. And the question is that considered an essential service? And I said, it can be postponed. We're hoping this will be for a few months. And there was questions about the legality of that. So do you want to speak to postponing a rabies vaccination a few months?
There are guidelines that are out now that are generally triaging rabies boosters as a non-emergency procedure, and different jurisdictions will have different lists, and sometimes they don't really give you a list, and so you can have to use your judgment. But everything I'm seeing is that is being triaged to non-essential. One great explanation I heard that really helped me sort these things, and they said, is this something you would go to the emergency clinic in the middle of the night to do? And if you could say no, you probably can say it's not an essential service.
This is Cinda. Can you hear me?
Yes.
Yes.
Okay. I had a conversation with our state public health veterinarian this morning, Dr. Danielle Stanek, about this exact question about rabies vaccination. And she will be drawing up some guidelines for our state shortly that we can make available to everyone. But there's definitely agreement that for adult dogs and cats who have a history of rabies vaccination in the past, and we do use the 3-year product, that this immunity does extend beyond 36 months. So it is safe, and these adults with a history of 3-year rabies vaccinations to postpone until we return to normal operations. The stickier question becomes for those animals who have not had a rabies vaccination, whether they're adolescents or newly acquired pets with a history of prior vaccination. And so that is a little bit of a different ball of wax. And we'll look forward to Dr. Stanek's recommendations about what to do with those naive animals who are not protected against rabies.
And I can say that what the national sentiment on that is to not to do vaccines and to keep those animals safe from exposure to rabid animals.
Right. Okay.
Yes.
So Todd is having technical difficulties, so they emailed me the questions. So let me read another question. The first one is, why are they testing tens of thousands of people with or without symptoms? Wouldn't it depend where in the virus the human was exposed to, similar to parvo?
So we can say that we're still behind in this country in testing people, and that is contributing to the spread. And there's a very interesting experience in Italy, where one part of Italy was only testing symptomatic people going to the hospital, and they had much more spread and death in that part of Italy. And in contrast, another part of Italy was testing not only people who were exposed, but then they would go to their neighbors and test their neighbors and all of the potential contacts they had, and they really isolated people based on that very aggressive testing, and they had a much lower rate of spread. And so that is why we would like to see widespread testing, but in most jurisdictions it's not available yet.
Right. So, and Dr. Levy, there was some people whose screen froze and they missed some of the slides. They're asking if you can share this presentation.
I will make a PDF of it, and Todd will help us share it out. So you'll have all the links, and you're welcome to share the slides around to your staff that couldn't attend. And this also will be recorded and will be available on demand.
Right, and also just remember that we're giving this presentation today, and the recommendations are changing so fast. So to pay attention to those things too. Thank you. Okay. The next question is, why isn't the government reaching out to the veterinary community for supplies? Here in Massachusetts, we have 200 plus shelters and rescues, many of which have supplies that will help. And I think the answer to that is that we have not been coordinated at the local, state, or federal level. So that's not surprising, but hold on to them, please, or donate them where you know there is a very high need. Do you want to add anything to that?
No, I think that really summarizes it. In some places, like here at UF, we've been asked to inventory all of our PPE, and it's already being donated to the Health Science Center. So I think it's only a matter of time before everybody is asked to share. We do have a brand new resource on our UF Shelter Medicine webpage as of today, which is a whole list of MacGyvers that we've come up with. We know that there's nobody that is more creative or frugal than veterinarians. And so they've been coming up with ways to recycle and re-autoclave surgery gloves and all of the gowns and drapes, and how to make your own sanitizers out of your medicine cabinet. And so we have just posted that on our website. And in fact, there's an anesthesiologist from our Health Science Center that developed a way to make an N95 mask out of pack wraps.
Great, awesome. Okay, the next question is a big issue that we are seeing all across the country. The question is, what they need is tips and tricks for getting animal control to agree to essential services like you're describing. And this person is saying our animal control is still bringing in owner surrenders that are not emergencies and healthy stray cats. We continue to share recommendations, but it doesn't seem to be helping. Can we return the strays to the field if they won't? What should we do with stray holds since we have limited hours?
And Sarah, I think that you're an expert at those topics, if you'd like to take that question.
Sure. I think one thing we'd like to make sure you have is all the information. The Daily Digest is amazing. The NACA recommendations, make sure you get those up-to-date recommendations to decision makers at the highest level. There is a letter that is actually published by the University of Florida, University of Wisconsin, National Animal Control Association, American Pets Alive, saying, please pay attention to these recommendations. So anything we can do to help and intervene and talk to your elected or municipal leaders, because again, what we keep talking about is the safety of people. And so this is about keeping the human population safe so we can continue to move forward, but make sure you have all those resources. Let's see. Some of these we answered in the chat. Dr. King is asking, was there an antibody response to verify the infection? So I'm assuming these are the positives for COVID, those 3, the cat and 2 dogs.
Sarah, I was going to say, Cinda, do you want to comment on the infected animals briefly?
The very first dog that was reported on, the 17-year-old Pomeranian fox in Hong Kong that lived in a household with an asymptomatic SARS-infected person, the test results for on swabs collected from the nose and pharyngeal cavity were pretty convincing that the animal did have virus in its upper respiratory tract over a period of about 5 days. There was no report that live virus was isolated from this dog. And eventually this dog did seroconvert or develop antibodies to the virus. So that's supporting evidence that he was infected. The second dog, the young German Shepherd in a household with a COVID patient, we only have the one report of a PCR positive test, but there's been no follow-up reports to show that this dog was PCR positive or that live virus was isolated from the respiratory tract over time. Then with the cat in Belgium, there's little detail available for that case. So it's hard to make a conclusion about the infection status of the cat with the actual human coronavirus, and whether this cat's clinical signs could be tied back to infection by this virus, or if it had some infection by a feline specific pathogen. So that's still, those details are still to be determined. So we've had seroconversion in only one dog out of the 3 reported cases, and that was the very first dog in Hong Kong.
Okay, thank you. Dr. Kirk, there was a question about telemedicine and the liability for the veterinarian. So can you speak to that?
Sure. As Julie mentioned, there has been a relaxation of telemedicine requirements in this, both federally and in the state of Florida. And the DPBR on March 27th put out an emergency order which says that any restriction which would prohibit active Florida licensed veterinarians in good standing from practicing telemedicine on their patients is suspended, providing the attending veterinarian is comfortable assessing the patient remotely and feels able to exercise good clinical judgment to assist the patient. So we did reach out to the FVMA, which is as overwhelmed as everyone, to try to get a little more clarification, but I think it's reasonable for us to assume that if a shelter has put animals out into foster homes, those animals are still owned by the shelter. So telemedicine should not be a problem. The question might arise, well, what if an animal was recently adopted and it has developed a problem? Or needs a refill on a medication and they haven't set up an appointment with a regular veterinarian yet. And that, I think all I can tell you at this point, and please chime in, is that, you know, you have to read this, this emergency order and interpret it. You know, we are in a critical situation right now. And I think that we really need to minimize face-to-face interactions as much as possible. And so I think it, again, as it says in the order, the veterinarian must feel comfortable with assessing the patient remotely. Any patients that are being seen by a shelter's clinic, you have that medical record, you have that patient relationship, so that should not be an issue. So I'm sorry I can't give you more specific details, but again, we have to, in my opinion, we have to view this as this is a crisis that we are all facing. And my role as a veterinarian is to do everything I can to assist my patient, but taking it in the larger context of this pandemic and what makes the most sense to keep people safe and to keep animals safe. And I welcome anybody else's input.
Yeah, I agree. And I can't imagine that anybody at this point in time is going to, unless it was something incredibly egregious, which I can't imagine, that veterinarians wouldn't also be protected under the Good Samaritan law, you know, to just trying to help while essential services of veterinarians, so many veterinarians are closed right now. So we have another question that is common and it's linked to the previous question about an animal control continuing to take in healthy stray cats or owner surrenders that are not emergencies. I got a question today from a shelter in Louisiana who said our public shelter is still doing that, but yet, and they're not fostering, yet we have a line of people in our community waiting to foster. And so my recommendation is for them to be the conduit to that. But again, the point is to have the shelter stop and really acknowledge and respect what an essential service is. And so another question was, about a limited intake shelter, they're asking the same thing. So the answer to you all is you should only be taking in emergency cases as well when you're a limited. So that goes for any shelter. Let me see if I think there's a couple of more questions. One of the questions, very serious for so many businesses. Statistics say 90% of small businesses are expected to shut down completely if forced to close for 5 days or more. How should the majority of us small shelters handle this? Dr. Levy, can you take that? Or Dr. Kirk?
I can jump in on that. There is, in the CARES Act, which was recently passed by Congress, there is a payroll protection program, and basically this program is a forgivable loan for small businesses, including 501c3s, to cover payroll and operating costs, which is amazing. And it also is for those who are self-employed and independent contractors. And you can find, I'll put the information where you can find that in the chat box. Again, the Small Business Association will forgive loans if all employees are kept on the payroll for 8 weeks and the money is used for payroll, rent, mortgage, interest, or utilities. And that's pretty amazing. So that might be of help for some of you.
That was amazing, and I want to encourage smaller shelters as well, or even rescues, look for ways to collaborate and work together. You're going to have to do business differently, and that means the business of fundraising and getting donations. And the more we can all collaborate and work together. There may be lots of organizations that have to merge together. We're going to have to be creative about how we move forward. Dr. Levy, did you want to add something to that?
No, it's so true, and it's scary. I'm hearing from major shelters, big ones that are famous across the country, that are preparing their furloughs to happen this week of most of their staff. This is something nobody could ever imagine happening, and the small groups, like, they can't even meet payroll for a week or two. They're always on the fringe. I have heard that that layoffs should be in the context of furloughs and not terminations, because that is going to facilitate access to the CARES money. But it's like an 800-page document. So we have representatives from our organized veterinary medicine and shelter and the folks who assist nonprofits going through all of these documents and trying to digest them for all of us, so that the people on the ground who really need the advice will get it. So be watching, sign up for that newsletter from the Daily Digest. That will be pushing a lot of information about the CARES Act and how to survive economically through that newsletter.
Awesome, thank you. Another question, Dr. Levy, if a pet comes into a shelter from a COVID positive home and that pet is on medications or special food, should the shelter staff be worried about fomites on those items?
Mm-hmm. So good question, and actually we've also wondered whether the pet itself is a fomite, and we've received some new information this week that there is a lot of work that was done in Asia on the epidemic, looking at whether hair is a effective fomite, and it is based on things like hair salons, where they actually tested people with hair, is that they do not believe that the coats of animals are an effective fomite. So that's why they removed the bathing. That's what we think is the case today. There also was a study that looked at the survival of the virus on different surfaces, such as cardboard versus stainless steel. And the virus lasted only a few hours on cardboard. So I would think paper would be like cardboard, but up to 3 days on stainless steel, and at least 3 hours in the air after an infected person or after virus was aerosolized into the air. So potentially you could be looking at fomites that are there for a short amount of time, and what you can do is just put those items away for a few hours if it's the cardboard, or a few days if it's something more solid and the virus will die.
I'm not sure if we lost Dr. Crawford and Kirk because I don't see them anymore.
I'm still here.
Okay. There is another question. When essential services, so a shelter in place and it's a mandate or what have you from the state government or your local government, can curbside adoption still be done after the stay-at-home order takes effect? Is that service considered essential?
We're staring at each other going, So I will say that still on the national level, what we're hearing, pardon?
Let's the three of us vote.
Yeah. So what shelters have come together at the national level, and believe me, we have like 6 hours of conference calls a day dealing with all of this, is we still consider to be safe placement of pets outside of the shelter to be an emergency essential service. So we are saying quickly get those animals into other homes, or if they can go straight from the home that they are leaving to a new foster home without looping through the shelter, that's ideal too. And we're standing up some software to help us do that more. Yes, we would say that it is still appropriate to do these no contact outcome procedures at this time. And our shelter groups are working with the folks that are drafting stay-at-home language and deciding on what procedures are still appropriate and trying to keep those live outcome procedures intact.
But everybody, the key is to not continue to take regular intakes into the shelter. You should just have emergency intakes, period. And that's where so many shelters are getting into trouble with having issues getting animals out. So please keep that in mind. The next question, Dr. Levy, what are recommendations for FVRCP and DAVBP vaccines in our susceptible juvenile populations in fosters, or those kittens and puppies?
So this is a hot topic that the shelter medicine groups are working on right now. So we're hoping to be able to get out some really practical guidelines for these critical situations. So for adults, and some other intake procedures generally can be safely done by a single person, so they should continue. And then that animal should leave as soon as possible. For the adult animal over 5 months of age, they probably don't need another booster. For the juveniles that are susceptible age, especially puppies that might be going outside in the yard, we do have concern about what will happen if they don't get their boosters, but we don't want them coming back to the shelter to get those boosters. So we're working on trying to figure out the most responsible balance for that. Part of it is advising people how to keep their pets indoors and reduce their exposure to outside where they would be picking up things like panleuk and distemper and parvo. And then also we just posted today some videos on how to vaccinate an animal, which are training videos for foster homes, and starting to look at actually dispensing the vaccines at the time of they go to foster, and then hoping that the foster home can actually administer those vaccines. But stay tuned for more development on that. It's a really important topic.
Yes. Okay. So with respect to pets from positive homes, their animal control facility is advising people to pre-plan and contact boarding facilities. And the question was about boarding facilities, but I think the answer is that's all individuals. You would have to contact your local boarding facility to find out what their policies are now, if they in fact are even boarding, how they're handling their businesses. Dr. Levy or Dr. Kirk, do you have any information about boarding facilities? So most boarding facilities seem to be closed, but there is a bit of discussion about whether they should become the facilities that are housing COVID exposed animals, because that would keep people at work. They generally have like double-sided housing and they're maybe appropriate places, and that would keep those healthy COVID exposed animals out of shelters so that shelter staff can keep doing what they need to do. There also, the national organizations are working with the boarding kennels to come up with more appropriate vaccination guidelines, because there's no need in this disaster to be
expecting a recent Bordetella vaccine or a flu vaccine, for instance, to keep animals out of boarding kennels. I also see quite a few comments in the chat that we froze up for a brief time, and enough people said it, so it may have been us and not the viewers. So if there is a specific thing that you missed as a group that we need to repeat, just type that in the chat.
Yeah, and I answered all the chat questions. Okay. So whether we did it live or in the chat, there's one last question that we didn't, and I'm assuming it's about the Megestrol, is what if a male cat eats the birth control pill?
Okay. So Megestrol acetate at the doses we're using is very safe. It actually has been used in higher doses in males for spraying. It's a very old school drug, and it had its purpose for behavior change treatments and for suppression of estrus for birth control. But at the doses that we used in the past, there were significant side effects like diabetes and mammary hyperplasia. And so it fell out of favor, but the new guidelines are very safe. So if the male gets it, it will be okay, but it's not being recommended for the males. Also, on the topic of males, we know that living with an intact tomcat's pretty hard, and that we've put all these intact cats into homes, and we're starting to hear some of the males coming back already because they're spraying. So we have given, discussed the thought that in certain circumstances, it may be appropriate to castrate the males before they go into foster or adoption homes, and that could be essentially considered an emergency or essential surgery because it would jeopardize the life of the animal if it went into the home and sprayed. And also, a veterinarian all by themselves can anesthetize and castrate and recover a cat without the support of technicians, so they can do that without putting any of their staff in jeopardy.
Okay, there is one more question. How does a hold on the adult rabies vaccination booster affect a bite quarantine? Good question.
Yeah, watch for some statements coming on that. Yeah, I think we're going to need an answer directly from NACA or the compendium to tell us how to guide that. I am guessing that people will still just you quarantine for 10 days in case the animal had rabies, because it will die within 10 days if it's rabid, so that won't change, right? That is still the case, that there would be a 10 days rabies hold. I am guessing that if it's being held at a bit, well, if it's overdue, and not every animal in a bite quarantine is overdue, but if it's overdue, and it's being held at a shelter with a vet or at a veterinary clinic, that they could vaccinate the animal on the way out, but that's not really essential.
Dr. Kirk, with respect to the CARES Act, the question is if you have heard, or Dr. Levy, if you have heard of any shelter who has received money, because this organization has gone on the website several times and it's not working, and I'm assuming it's just because it's so overloaded, but have either of you heard of any shelters that did get through or any response? I mean, it was so recent as well. No?
Right. What I am seeing is that lenders will begin processing loan applications as soon as April 3rd. So that to me says nobody's received the money yet. So all I can suggest is that you keep trying, and I'm sure that that website is really being overwhelmed.
And somebody says, contact your local SBA bank. This is from Dave Waleski. Dave, I need you to clarify this. This is a question from the director, Diane. Community cat caregivers are coming to us for permission to still feed their cats in the event that they are subject to the stay-at-home order. I'm thinking, Dave, what you mean is that they can't go out, but I'm assuming you also mean colonies, so that
I know what this is about. This is folks that feed, have a feeding route of some kind. They go out and they feed their colonies, and they've been asking if they are allowed to go out, and that may depend. We don't have the details of the stay-at-home order yet. Sometimes these orders do allow people to go out and like go for a run as long as they're not around someone else. Sometimes there's a curfew involved. And so those local, or I guess statewide directions that we get now will dictate whether people are allowed to go out, technically allowed to go out and feed their TNR cats or not. You could imagine how it could be safe if you are all alone and you have your food and you're not contacting other people. In theory, that would be safe to do. But we haven't seen the details of the expectations yet.
Okay. So did you want to say something, Dr. Kirk?
Oh, just that I was looking in the chat box and Patty Cutler mentioned that her banker just contacted her. So if you contact, this is all a foreign language to me, but you can apply through an existing small business association 7A lender or through any federally insured depository institution, credit union, etc. So if you go on I gave 2 website addresses, and if you look on those, I think you can probably find more information and more detail than I can appropriately advise you with.
Okay, great. So there was just one question to repeat what you said about the positive cat and the ferret and any link. The person missed that part. So if you could just repeat that, Dr. Levy. We had some technical difficulties in the middle.
Yes, there's a report out of China where they experimentally infected ferrets and cats separately. It wasn't a cat plus ferret study. It was a ferret study and a cat study. And they were able to experimentally infect ferrets, and the ferrets got kind of more upper respiratory disease and did shed virus. And that's not a surprise because ferrets have the receptor for this virus. And similarly, in the cats, they were able to experimentally infect cats. Cats also have the receptor, and they became infected in the first SARS outbreak as well. And they got more serious disease. They got upper respiratory disease and they got pneumonia histologically. And what was most disturbing, but not entirely surprising, is when they housed a cat in the same housing unit with the experimentally infected cats, that cat that was exposed became infected. So this is really the first evidence of cats transmitting the virus to other cats. Now we just have to take this all in the context of it was experimental infections. There's not a lot of information about how it was done or the levels of virus that were found to be transmitted. But we'll probably be hearing a lot more about this, and this newly emerging information may continue to impact the recommendations and guidance that we're getting for how we handle and segregate cats especially. So cats and ferrets should be the species that we are being most careful about separating from sick people.
Okay. Good news from Michelle Quigley. She says Florida Executive Order 20-91 does list taking care of pets as an essential activity.
Oh, yay, yeah. Florida.
Oh, thank God. One good thing, one good piece of good news, right? Awesome. Okay, great. Hold on, let's see. This is more of a comment. Our state in Massachusetts has allowed us to adopt pets out of our shelters as long as we are being safe. I'm assuming you disagree with doing this. We are very lucky. We only have 4 cats in our entire shelter. Good for you, Lee. No, we absolutely want animals adopted out. The point is to get everybody pushed out through adoption and foster, so that you have no animals left in the shelter except for any incoming emergencies. But right now, this is the time to get animals out to that live outcome opportunity, whether it's adoption or foster, absolutely. So good for you, you only have 4 cats. So hopefully you get those 4 out and you have no other emergencies and you'll be golden. That's amazing. Let me just check one more thing. So the question you already answered, do you know if the cats can spread to other animals if they're infected? And at this point, we have no reason to believe that is true. And then, Dr. Kirk, do you want to comment about transports and what's happening with transport recommendations?
Dr. Levy might know more about that than I do. I think that, again, we have to balance things. We want to save lives with our shelter animals, but we also don't want to have a lot of human to human interaction going on. What I've seen is perhaps trying locally to work with neighboring shelters rather than these big transports that leave the county. But please, Julie, if you have or Sara, if you have other thoughts on that or have heard other discussions.
There is a new guideline statement that came out from the shelter medicine group that recommends pausing transport, except in some exceptional circumstances that are closing in as we get more and more states having shelter-in-place orders. So yes, we said you can. It's appropriate to transfer within a community in order to save lives and put the animals in the places that have capacity, but that we should not be packing up big trailers fulls of animals and bringing them to other communities, because that is going to increase the amount of interpersonal contact between people and grocery stores and gas stations, and the loading up and the unloading of the animals, and also potentially bringing virus from areas of high virus levels in people to areas that may not be as severely affected at this time. So there's, if you go to the University of Wisconsin Shelter Medicine Program website, all of these documents we've been talking about are posted there in one place, and so you can read the details of the document there.
Great, thank you. And just to reiterate, Dr. Levy, if an animal, cat or dog, comes into a shelter from a COVID positive home, it's normal vaccines for that pet, and then a 2-week quarantine, correct? Or not quarantine, 2 weeks.
So we haven't been calling it a quarantine because that has some legal and procedural conditions or implications. So we've been calling it just segregation. A separate run is fine, roped off from common contact, and try to minimize contact. There are guidelines even for walking those dogs, being careful and using PPE. So it's not a really rigorous quarantine like we would think of for parvo or distemper. And I just realized, I did have one blank slide that didn't play, and now I kind of remember what it was. I think it was the call out to the website for American Pets Alive, which has a preparedness guide, which is full of procedures and protocols, so you don't have to write yourself. And so if you just search American Pets Alive, you will, right on the front of their website, you will find their emergency preparedness guide. And it's really, I think, the most useful document I've seen.
If I can just jump in here, I just got an answer from the FVMA on our telemedicine questions.
Oh, great.
So the question about if the animal is in foster, but is and has been examined by a veterinarian, then the veterinarian can consider the animal as a patient and can use whatever means are available. So as a shelter veterinarian, if this is an animal that's come from your shelter, you have examined that animal at some point, I would presume. So that's good. They recently adopted one. Telemedicine can be used on a patient of the veterinarian, whether the veterinarian knows the owner or not. So if the veterinarian examined the animal, then telemedicine can be used. As far as a public clinic, it says current patients of a shelter that are owned by the shelter. I don't think he understands that. Understood my question. Because those current patients are not owned by the shelter anymore. We're assuming these are owned animals. As to the general question, may telemedicine be used for first-time client patients? The language of the emergency order allows veterinarians to practice telemedicine, quote, on their patients, which indicates that an established veterinarian-patient relationship already exists. So if they have not been seen at your public clinic previously, it sounds as if the FEMA is saying you should not be using telemedicine on those patients.
So that'll be an area that we probably need to work on policy-wise, because there are a lot of people who do not currently have a veterinarian, and they are going to need care, and we don't necessarily want to drive them to the emergency clinic to get that care. So this is an example of the sort of rapidly changing situation that our current policies don't have room for.
Right, and they don't probably, the FEMA wouldn't know that right now the adoption and foster numbers are so much higher than normal, and that, again, this is an emergency situation. So I think it does warrant a special consideration. The CDC, Dr. Levy, when they came out with the updated recommendations for a pet from a COVID positive home, said that that pet could be cared for in someone else's house, but they would have to be kept separate from their animals. But if they entered a shelter, that they would have to be held for 14 days. So can you explain what the difference is, like why that pet during a shelter, entered a shelter, why that pet couldn't be fostered? Like, what is the difference?
Yeah, it is an inconsistency, and I don't know if it's intentional, just or if they're still working on coming up with new guidelines, but definitely it seems not to make sense that if it comes to your shelter, it has to stay for 14 days, or if it is just passed off to a neighbor, there's no restriction on how long they have to hold it. That is the guideline as of today. Right,
and then if the person comes back within 7 days, I mean, then they would go back home. That's
for sure. Like if the owner can take it back before 14 days, that's fine.
Right. Okay, great. All right. Okay, this one is again about spay neuter, that they have a large event scheduled for next week, and should they cancel?
Why, yes, they should. Yeah, that would be our recommendation.
Yes. Yes. Even though they said we're going to go to the car and get it, but it's more about your staff. The interaction with the people is one thing, but your staff working so closely together. The PP is a secondary, but the most important thing is our shelter in place and our ability to pass the virus, even if we're not clinical.
Exactly.
Okay. That was all the questions. I believe we got through all of them. Any closing comments, Dr. Levy or Dr. Kirk?
Well, I'm just so proud of how our people in this industry and across the veterinary profession and in our communities have stepped up to preserve the function of animal shelters and animal welfare and to keep pets in their homes. It's really gratifying that even with all the uncertainty and the fear, that people have this sense of community and taking care of each other. And I think the worst is yet to come, so we're really going to need to lean on each other.
Yes. Dr. Kirk, any closing comments?
Well, just that, just to echo what we've been saying, and we're all in this together, and it's a rapidly changing situation, and we all just are trying to keep on top of everything and provide the best information we can. So I hope everyone will feel free to reach out to us as needed.
One last question. Are we going to have this meeting, Lee says, was very helpful. Are we going to be doing more of these in the future?
We'd like to. I think we're going to need to, because we know that the answers we gave you today, this will be just like vet school when we said half of what we tell you is wrong. We just don't know which half. You're watching that in real time right now. So we will try to keep the channels of communication open. We will be continuing to communicate through our shelter medicine newsletter too. So if you are not on the UF Shelter Medicine newsletter, make sure you go to our website and sign up, and then sign up for that daily digest newsletter as well. That's how you're going to stay up with the daily changes. And then we'll try to schedule some of these webinar chats on an ongoing basis as well.
Yes, and I just want to encourage everybody. There's just amazing creativity happening in life-saving all across the country and in Florida. but there are shelters that are lagging behind and still have way too many, hundreds and hundreds of animals in the shelter, and are not proactively trying to get all of them out in foster or adoption. So we want to encourage you. This is the time. Your community wants to help. There are people out there that really do want to help. And so please look online at all the amazing creative marketing tools. The ASPCA did a great video about, hey, you're home right now and we need you. This is a life-saving issue right now. And Maddie's did a great presentation about fostering. There's so much information online. Copy somebody's ideas and get to it. Because also what I learned last week on that Maddie's webinar was emojis work. Emojis do bring out the emotion in us, and you have to make sure that people know this is linked to life-saving. This is an emergency situation, not just for people, but animals, and we have to get all these animals out of the shelter. So great job for all of you guys on the front line. We're proud of you and we're with you.
And I'd like to thank Virox for making this webinar possible and for hosting us. I think they're still with us, and I know they had some audio problems, but if they would like to come on before we depart and let us know what the next webinar is. I think they have one tomorrow maybe for us.
Yes, and let me see, because I think that Todd, okay.
Todd's back.
Todd is back. There is Todd. I'm looking at my text. Okay. Thank you, Todd. Todd, this was
with a voice, though.
This was so helpful for everybody. I don't know if you've been watching the chat, but everybody really appreciates this time with us, and we're happy to have them. So thank you so much for hosting.
I'm sure Todd's saying something nice.
Thank you. Thanks, Virox. Bye-bye, everybody. Stay safe and stay home if you can.